Hi there, welcome back to Test Don't Guess Tuesday. I'm your host, Melissa Hall-Klopacki. I'm a functional gut health expert, and I work with men and women around the country to take them from constipation to liberation by understanding the root causes. One of the ways we do that is using the GI map test. And while I just told you that I'm usually working with patients with constipation, I want to tell you about this interesting case that came my way. This was a 38-year-old woman. I'm going to look at my chart notes. A 38-year-old woman who had a new case of arthritis at 38. That's not great, right? No one wants arthritis at 38. She noticed that her joints also felt red, hot, and swollen. She was going to the bathroom, excreting 10 times a day, always liquid. Sometimes it would wake her up in the middle of the night. There was undigested food in her stool. There was also quite an odor to it. She also had a lot of cramping. Another symptom that had crept up recently was some cystic acne, and at 38 years old, we know that's not normal, and lots of fatigue. So she came to me saying, I don't know, I really want to run this GI map that I hear you talk about. Can you help me? Great. So we ran the GI map test, and let's take a look at what we found. Okay, this is a look at her GI map test. Remember, it's 4 pages long, and I prevented her name from being shown for her security and safety. So this is the very first page. If you remember how we read this test, on the left-hand side is the bacterial pathogen. In the center is the patient's result. And on the right-hand side is the reference range. Note that you can have a result that is not necessarily red and in the high, it's just not above their reference range. So first off, what do we notice as soon as we pull up the first page of this test is an extremely high level of C. difficile, C. diff, we call it. Very common when someone's had lots of antibiotics, and she actually had quite a few rounds of antibiotics. She had been sick in the winter with a bad cold that turned into an ear infection and also walking pneumonia. So she had been sick 6 months prior to doing this test, and that can lead to increased levels of C. diff. So that's the first thing to note on this test, and something that will absolutely need to be treated immediately. Page 2 of the test, right? Let's see what else is overgrowing. So we see here Enterococcus and Streptococcus are both high. A little bit alarming, the strep is pretty high as well. And then there are some other overgrowth of microbes, but nothing alarmingly high showing on this page. No candida, no fungus, and not testing positive for any viruses. So far we know C. diff, Enterococcus, and Streptococcus are high. Let's take a look at some of the reasons this could be. For that, I skip over to page 4. We're going to go back to page 3, but I want to show you here. Blastocystis hominis and all the protozoa are negative. Worms were not detected in her stool, but this intestinal health marker section is really, really important. And let's see what we can pick up here. The first section, her digestion seems to be doing well. She has no steatocrit and relatively great levels of elastase. That's telling me that the digestive enzymes are doing their job. So it doesn't seem to be a stomach issue. The next section, the GI markers, beta-glucuronidase, talks about how the body is processing hormones here and doing a great job here. And there is a tiny bit of occult blood in her stool, but she had noted bloody diarrhea, and she did have a diagnosis of inflammatory bowel disease. And her doctor was aware that occasionally there was blood in her stool, so I was not surprised to find that here. However, the secretory IgA level is off the charts. 2,000, right, is the high end of normal, and here we are at 6,000. That tells me there is some sort of infection brewing. Inflammation levels in the gut are high. We look at anti-gliadin IgA, also high. This client needed to come off gluten immediately. Unfortunately, her doctors had told her that it didn't really matter what she ate. And obviously, when we're dealing with gut issues, friends, all of you out there listening, when we're dealing with gut issues, what you eat is almost all that matters. So taking her off gluten reduced that inflammation level right off the bat, and she had to be extremely strict about avoiding gluten. Her eosinophil activation protein is normal here. You'll see calprotectin edging higher, showing inflammation, right? There's inflammation building in the gut. And when we look at zonulin, that is a marker for leaky gut. And here, obviously, she has a problem with leaky gut. That tells me this at the very end of my program, whenever we are done eradicating or killing bacteria, the last step is to heal that gut. And for her, it's going to take some time because she has a rather leaky gut. So let's go back to page 3 and fill in the blanks here. You'll see here at the top a little bit of H. pylori, nothing to write home about. And like I said, her digestion seemed to be fine. Remember that H. pylori lives in the stomach. So I am looking for digestive issues and stomach pain when I'm thinking about whether or not H. pylori needs to be addressed. But here I think we're okay. Looking at commensal and keystone bacteria, you can see the trend here isn't that things are overgrowing, but that there's not enough. Escherichia and Enterobacter levels are very low. That means she needs a good, well-rounded probiotic. So we put all of those pieces together, and what did we do? This client was on a 6-month protocol. We started by opening drainage pathways. If you've heard me talk before or know anything about the work that I do, drainage pathways always must be open before we attempt to kill anything. We know that there is a big overgrowth of C. diff. Killing that's going to cause major disruption in the body. And unless you're able to move the bowels regularly, right? And in this case, we know that she is a good bowel mover. That is step 1 when we're dealing with killing anything in the body. So we approached this with keeping drainage pathways open, getting her sweating. I got her into the sauna. That made a big difference for her. And then we approached it twofold with Cellcore Bioscience detox work and with Biocidin, which is my preferred agent for broad spectrum antibacterial, antifungal for the gut. And so we titered up on Biocidin in the 2nd month of the Cellcore protocol, using Biocidin drops, going from 2 drops a day all the way to 15 drops twice a day, really working on keeping that in the gut, taking care of some of that C. diff. In the 1st month, she was able to have stools that were maybe 5 times a day instead of 10 times a day. We also used a very potent probiotic as we were trying to replace. We talked about here some of these Escherichia and Enterobacter, but just making sure all of these other levels stay nice and high. We used Saccharomyces boulardii, which is a great probiotic when we're dealing with C. diff. And we put her through the parasite protocol. So she wound up passing a ton of parasites once we were able to get started on both the Biocidin and step 2 of the Cellcore protocol, which is eradicating parasites from the digestive system. The rest of the protocol worked on liver flukes, which she had some, and heavy metals, environmental toxins, right? We know that we all are harboring those, whether or not we're testing for them. We're all exposed on a daily basis to lots of environmental toxins. So the 6-month program had her completely healed. At the very end, we used one of my favorite products, which is right here, GI Revive. 7 pills a day. They're little capsules containing L-glutamine and glucosamine and pectin and licorice and aloe vera and slippery elm, marshmallow root extract, cat's claw, okra, really healing for the gut. We want to seal the gut up after we've done this work. And she did great. So remember, you don't always have to use pharmaceutical intervention. A lot of times with C. diff, that's what got people there in the first place, too many antibiotics. And so we kept her on good probiotics. She had a maintenance schedule going forward and did great. So please remember that healing is possible whenever you're dealing with something like a GI diagnosis, and you are not your diagnosis. Inflammatory bowel disease doesn't tell us much, right? It tells us that the bowels are inflamed, but it doesn't tell us why. We needed to make some dietary changes. We needed to make some stress and lifestyle changes for her as well. Remember, it's not always as simple as what do I take? Or what do I avoid? It's foundational medicine needs to be laid. The way we sleep, the way we eat, the way we think, the way we breathe, all important when it comes to healing. So I hope you've enjoyed this. This is Test Don't Guess Tuesday. I'm Melissa Hall-Klepacki. I do this every week. Come back and learn with me. Big love.